Thank you, Christy. Well, you probably recognize this man here, Dr. Stephen Thomas from Upstate. He's joined us quite a bit through this whole coronavirus COVID-19 outbreak. He's here to answer some more of our questions. And first of all, Dr. Thomas, as we see more tests being done, more people testing positive, of course, that's putting a strain on our healthcare system here. And I think one of the biggest concerns is our healthcare workers and the PPE, that protective, that personal protective equipment that they wear. How are we doing with that right now? The masks, the gloves, the gowns, etc.
Yeah, so right now we're in a good spot, and we're in a good spot because we made sure to stock up quite early in this whole crisis that we're dealing with, and we're trying to be very strategic about the use of the PPE that we actually have. But there is definitely a limit to the stores we have, and there has definitely been a disruption in the supply chain. So we've been very fortunate at Upstate that we've had a lot of generous output from the community to help us try to procure some of this equipment. But right now we're good. But, you know. Yeah.
we shall see. We've heard so much from the governor talking about flattening the curve, and the real concern there is how many ICU beds and ventilators do we have for people? Obviously a really big concern downstate where the numbers of population just so much more. How are we doing here as far as ICU beds in case we need them?
Right. So it's not just intensive care unit beds. Matter of fact, the majority of people are in non-intensive care unit beds, right? So right now we're good. It's kind of like the supply. So right now we're in a very good spot. We have plenty of beds to take care of people. But again, if that curve is not flattened, if that curve continues to peak, as we've all seen, you know, what those curves can look like, then we could potentially be in a tough spot.
So do we have a plan in place should that happen? Hopefully it won't, but should it?
Absolutely. So every hospital has a plan to surge. So surge in terms of the number of beds that they are able to occupy or you know, put into place. Surge in terms of the number of ventilators that they may have. So yes, we have a plan in place. We are far from needing to execute that plan right now, which is good, but we do have a plan.
One thing the county executive, now from the governor to the county executive, Onondaga County Executive Ryan McMahon has talked about, and there's not a lot of businesses open out there anymore, and there will be even less coming this weekend. But restaurants are still open for takeout. Now, we've gotten a lot of questions from viewers that say, like, if we shouldn't be going out, if we shouldn't be at restaurants, is takeout safe for us?
So I think it depends on how they've actually set up the process of you picking up your food. So I know where I live, there have been some innovative ways of kind of organizing the takeout, in that they may allow only one person into the store at a time to try and again keep that social distancing in order. So it really depends on how your favorite restaurant is managing their takeout process.
Now, we have also talked about getting back to COVID-19 a little bit. People worried about whether they're exposed or not. We get calls all the time. They think they are. They think, what should I be testing for? What are the symptoms, and how long would they actually take to show up? What should we be looking for, and kind of a time frame we should be monitoring those?
Right. So that time frame is what we call the incubation period. So it's the period of time from when you get exposed to the virus to when you start developing symptoms. The information and the data that we're getting both from the experience in Asia and in Europe and as well as the United States, the majority of people, it's about 5 days between the time that they get infected and the time that they develop symptoms. More than 97% of people, it will be within 10 to 11 days.
Okay. Another question we've gotten, once people are infected, how long are they contagious? Is it that 5 days? Is it the entire 14? How long could they potentially pass that on to somebody?
Yeah, that's a really good question, and unfortunately we don't know the answer specifically. But what we can say is people are probably infectious within a day or two before they develop symptoms, and typically by the time their symptoms have been gone for around 3 days, they should no longer be contagious. That's what we believe right now, and of course this is being studied in depth in places like California and Washington and New York and overseas.
We're learning so much throughout this, aren't we? So as we continue to get information, and we'll keep having you back, you'll keep providing it for us, of course. So we've got, of course, more information for you all the time. As we gather it, we give it to you. We put it up on localsyr.com. We've got it on the News Channel Line app. You can go there for everything.